There's a changing need in our population, different age groups, different presentations, different capacity for childbearing with our in vitro fertilization technologies that expanded, which means that we're seeing a change in the patient population that we serve. And I often say 70–80% of births, really there's not much more that we could change because things are very normal, and there's a very good trajectory with little intervention needed, just support. But there's a few of the more complex situations. So that's where I think the research that we're focusing on is helpful. So currently some of the research projects we have ongoing in the obstetrics world are recruiting prospectively patients who are getting vaccines in pregnancy. Particularly right now, we're actually focusing on the COVID-19 vaccine. It's very topical, and it's been very important for our patients because they're been a high-risk population when they do have illness, but the vaccines have really protected them, and that's been well established. But what we're now focusing on is there a certain time that they receive the vaccine where we see more antibodies in the baby after they're born, and we're looking at how long those antibodies last. We also are looking at maternal diseases. So I mentioned that's a big part of maternal fetal medicine, and we're looking at how we provide that care in Ontario to pregnant individuals who have pre-existing conditions. So it's called the Connect projects, because it's looking at connection to care, and if there's the right balance of what we should be doing to provide good outcomes. And finally, I'm really interested in breastfeeding. Breastfeeding we know is good actually for moms and babies because it can help their cardiovascular health. So we're looking at how we can improve breastfeeding initiation at our hospital, and providing excellent education so that they can do it successfully. We always have to adapt and change for the changing needs of the population, and I think as much as we think it's the perfect way, there's sometimes always a newer, better way to potentially do something.